Nurses and doctors could play drinking games about how many medical errors they can spot in a single episode of Grey's Anatomy, House MD, or General Hospital. Ever wondered how accurate medical TV shows are? The truth might just have you flatlining. The classic flatline scene has appeared in so many TV shows that it could challenge Mickey Mouse for cultural relevance. You know the one. It's where the patient's heart stops, so the monitor shows a flatline. Oh no, the doctor says, get the De-FIB-rillator. The doctor presses those scary metal things to the patient's chest and yells, clear! Electricity zaps the patient, restarts their heart, and the day is saved. Yay! Here's the deal. The correct term for a flatline is asystole, which means that the heart ain't doing squat. It's not pumping. There's no electrical activity. If asystole occurs, chances are you're a goner, and the De-FIB-rillator won't help that, according to Dr. Michael Vegg of Deakin University School of Medicine. See, there are shockable and non-shockable heart rhythms. If the heart's beating too fast or too chaotically, you can shock it back to a regular rhythm. However, shooting electricity into a stopped heart won't do anything. According to the American Medical Resource Institute, the correct treatment for asystole is CPR and a dose of epinephrine every 3 to 5 minutes. Yes, that's right, minutes. This is a marathon, not a sprint. And even with emergency treatment, less than 2% of asystole victims survive. So yeah, if someone's heart stops, don't grab the miracle paddles. While we're breaking a few eggs, might as well bust the whole pack. The reality of the De-FIB-rillator is disappointing, but cardiopulmonary resuscitation, or CPR, isn't all it's cracked up to be either. To be clear, CPR saves lives, period. But the way TV presents it is scarily unrealistic.
Fred? No pulse. I'm starting compressions.
Cap, medical's here.
On TV, CPR seems to save anyone except clearly that frozen jabroni. However, according to research cited by the New York Times, only 40% of patients who receive CPR after cardiac arrest survive the immediate resuscitation, and less than 20% make it to discharge. The CPR process itself can cause cracked ribs, brain damage, and bruised lungs, if a patient even survives. In an interview with CNN, Dr. David Newman claimed to remember every single patient at his hospital who had ever made a full recovery after CPR. Not because he's got a photographic memory, but because he's never seen more than one person a year come out of it alive. So yeah, most people who request CPR in case of emergency have no idea what they're getting into. But take note of the fact that according to NPR, doctors tend to say no to CPR. The statistics are pretty mind-blowing. 9 out of 10 young doctors who are finishing their residencies would refuse CPR. If doctors don't want CPR, should you? Everyone makes their own decisions, but proper information is key. You ever get stuck with a doctor who is just a real piece of work? Okay, well, has your doctor ridiculed the shape of your nose, teased you about your sex life, mocked your religion, and then walked away with his cane while popping Vicodin? Has that happened to you?
On average, drug addicts are stupid.
Probably not, because as brilliant as he is, Gregory House's medical career would have gone up in a dumpster fire years ago. According to House MD vs. Reality, a book by CNN medical correspondent Andrew Holtz, doctors who behave inappropriately receive formal warnings that can escalate to getting fired, peer review, and the loss of their license to practice medicine. But let's cut House a break, because his show isn't supposed to be realistic. The whole concept is based on what an anomaly Gregory House is. He's supposed to defy all medical norms. Unfortunately, Grey's Anatomy, we can't be so easy on you. The doctors on this show routinely partake in procedures, hijinks, and disasters that should have gotten them all fired multiple times over. These actions might be fine and dandy at Gray Sloan Memorial Hospital, but in real life, yeah, no dice. Let's just get this dumb clip out of the way so that we can get on with the truth about organ donation, shall we? Remember One Tree Hill? Then you'll remember this.
Dr. Casper. Nurse Henderson to admitting. Nurse Henderson to admitting.
Why do medical shows always present organ donation as being creepy and weird? Sure, the term organ donation conjures up images of Dr. Frankenstein digging up a graveyard, but in reality, organ donation is fantastic. According to Live On New York, a nonprofit organ procurement organization, just a single organ donor can save 8 lives. And the transplant success rate is 80 to 90%. Pretty awesome, right? There aren't even usually any dogs around. Live On New York also rattles off some super weird bullet points though. They swear that buying and selling organs is illegal in the US. You'd certainly hope so. And even reassures readers that doctors won't let you die just to procure an organ because they aren't named Frankenstein. Both these points should be obvious. Why bother pointing them out? Because TV portrayals of organ donation have scared the hell out of people. In the early 2000s, studies were conducted on TV's organ donation storylines. In a Forbes interview, Professor Susan Morgan, co-author of the studies, called the results an outrage. On TV, organ donation is usually presented negatively, often with ridiculously implausible scenarios, like a patient prematurely being declared dead so her organs could be harvested, or a surgeon running a black market for organs. As Morgan points out, these representations have the real impact of making people wary of organ donation. That's far scarier than any silly fictional organ market ever could be. Doctors are smart. They have to be, considering they spend approximately 400 years of their lives in school. However, doctors aren't perfect. They're human, they make mistakes, and they're as prone to the pitfalls of confirmation bias as anyone else. Unlike TV doctors, who possess extraterrestrial brains capable of accurately diagnosing and fixing every ailment. Because everyday people see this on TV, they assume that anytime they have questions, doctors will supply correct answers. Not always.
He's two people in one. It's called chimerism.
See, doctors don't want to say, "I don't know," because that's just embarrassing. So if they really don't know, they might just hang their hat on a term like medically unexplained symptoms and call it a day. Basically, that just means they can't explain it. As physician Lisa Sanders says in a Quartz interview, if patients realized how little doctors actually knew, they'd be way more scared and probably take better care of themselves. As described by the New York Times, doctors are victims of the same biases as other people. They see what they're expecting to see, but sometimes the actual ailment differs from that expectation. If they expect a treatment to work, they'll assume it did work, even when it doesn't. So sometimes doctors are right and sometimes they're wrong. But that's okay because they're humans. In the writing room of any medical show, it's easy to picture a whiteboard like the one from House with a list of suggestions about how to punch up a boring scene. After lupus gets crossed off, because seriously, it's almost never lupus, there's one really easy way to maximize excitement before a commercial break. Give the patient a seizure. Here's the thing. If your friend ever starts shaking, do not treat that seizure the way they do on TV. Hell no, don't hold them down. And hell no, don't stick something in their mouth. You could break their teeth, and you'll be paying their dental bills for the next decade. Also, stop worrying about them swallowing their tongue. It doesn't happen that way, no matter what horror stories your great-great-grandpa told you. All that hold them down, put something in their mouth nonsense you see on TV directly contradicts seizure protocol, according to Time and a researcher who estimated that 46% of seizures that happen on medical TV dramas are responded to with wildly inaccurate protocol, with 25% being rated as indeterminate. So maybe those TV doctors should read proper seizure protocol, as outlined by the Epilepsy Foundation. Namely, stay cool, don't hold the patient down, talk calmly to them, and just try to make them as comfortable as possible until the seizure subsides, unless it lasts over 5 minutes, at which point medical assistance becomes necessary. It seems like all TV healthcare workers go to work at the same time in the morning, share the same lunch break, then punch out just in time for the whole crew to kick back some beers. How convenient! In reality, common nurse shifts vary between 8 and 12 hours, according to Rasmussen College. Hospitals are rocking around the clock, and someone's got to be on duty 24/7. While 12-hour shifts are popular, some nurses opt for double shifts of 16 hours. So sure, they might get drinks later, but not until midnight, and with dark circles around their eyes. Meanwhile, the hours that doctors work are like a feverish nightmare. During their residency, doctors are expected to put in insanely long hours, according to The Atlantic. How long? Try 80 hours a week. If that wasn't enough to cause projectile vomiting, young doctors have to grit their teeth through single shifts that last up to 28 hours. If you're scared of getting treated by a doctor who resembles something from The Walking Dead, you're not alone. A study cited in the journal PLOS Medicine concluded that these crazy long shifts caused an increased risk of medical errors and other bad mishaps. Duh. Predictably enough, the reason for this ludicrousness is the long, cold talons of corporate capitalism. As told by The Atlantic, administrators use young, eager residents to plug up their staffing gaps with cheap labor. Being a patient is one of the most vulnerable positions a person can be in. A patient tends to be sick and scared, while the medical professional controls their medicine, their dosage, and their treatment. The inherent power dynamic between a patient and a hospital worker is far too easily exploited, which is exactly why it's definitely not okay for doctors and patients to wrestle in the sheets together. The American Medical Association gives romances between doctors, patients a big fat no stamp, calling the practice unethical. Sure, House's resident heartthrob, Dr. Robert Chase, falling so in love with his patient, a nun, no less, that he sleeps with her makes for great TV. But in reality, it would shatter a medical career in seconds.
You were right. I was running away.
In real life, if a medical professional gets it on with their patient, they stand a good chance of getting fired, and they'll definitely ruin their reputation. According to the New York Times, one physician who got in a consensual relationship with his patient earned himself a $10,000 fine, plus 10 hours of ethics education. Meanwhile, a survey by Medscape showed that 68% of physicians are firmly against romantic relationships of any kind with patients. When it comes to former patients, 22% think it would be okay if they had not been a patient for 6 months. If shows like House MD are any indication, next time you pass out without warning or suffer an unexplained seizure, you should probably make sure someone cleans your living room, because there's a good chance your doctors will break into your house, whether it's locked or not, and go through all of your belongings, personal secrets, and samples.
Patient's file said she lost some weight on a new diet, right?
Yeah, she went vegan.
A laxative's vegan?
The fact this question still surfaces on the internet every now and again is a good indication that some people are really worried that Dr. Taub might be going through their stinky sock drawer. So let's clear it up right now. No, doctors don't have any legal privilege that allows them to break into your house. House's technical advisor, Dr. Lisa Sanders, has even clarified just how unrealistic this part of the show is, calling it, quote, thoroughly unprofessional behavior, besides being creepy, invasive, and so on. Sanders points out that the show portrays the doctors doing this as a metaphor, as the breaking, entering scenes visually symbolize that genuine sense of violation that many patients feel in response to medical questions and probing.